In the U.S., the nurse forcibly quarantined over Ebola fears is headed home. The New Jersey Health Department says that Casey Hickox has been symptom-free for 24 hours. The nurse says she never had symptoms and tested negative for the virus when she returned from West Africa on Friday. She became the first example of the state's new 21-day quarantine for Ebola aid workers. The nurse says she will file a federal lawsuit as a result of her mandatory isolation. The federal government plans to examine those state quarantine policies like the one in New Jersey. Let's get more from Robert Murphy. He's live from Chicago. He's the director of Northwestern University's Center for Global Health and a professor of medicine and biomedical engineering. Thanks so much for joining us. White House currently working on new guidelines for healthcare workers returning from Ebola-stricken areas. If you were to help them write these guidelines, what might they look like?
Well, what they would look like is what the science has already told us. We know how this thing is spread. We know what's really high or even medium risk. And what we don't need is politicians injecting hysterical fears into the policies that need to be made. We need to encourage more people to go over there and attack this thing at the source, as your previous broadcast illustrated. So I would say that we need to treat the people returning with respect, and any kind of mandatory quarantining of an asymptomatic person is completely ridiculous.
And Robert, the mention that you mentioned the story from Monrovia where he said it was irrational fear and anxiety in Monrovia. He was walking around getting a Coke, obviously not in any kind of garb.
No.
Adding to the irrational fears, perhaps, with these actions?
Yes. Yes, he has added to the irrational fears and hysteria, which is not going to make anything better. It actually will inhibit people from volunteering to go over there. If they think that they come back, they're going to be treated like the nurse was, who just returned.
Interestingly enough, though, he said he's unapologetic today that he doesn't represent this nurse, even though she said the actions were inhumane. He said he represents the people of the state. He did the right thing. However, the United Nations Secretary General Ban Ki-moon says that, if these healthcare workers keep coming back and facing this sort of stigma, it really is going to cut down on the number of people who are willing to go over and take part in this fight. Do you think he's right?
He's absolutely right. You go over and you work in one of those three countries for 2 weeks, 4 weeks, whatever your tour of duty is. This is one of the most challenging things in a person's lifetime. You're going to see things that nobody else has ever really seen. To go through all that, a very stressful environment, and then to return home and be treated basically like a criminal, is really not going to help the situation. We have to attack the source. This will require volunteers, and we need to treat them with respect.
Robert, we've been spending a lot of time talking about the United States, but Australia today said that they're stopping the process of visas from West African nations affected by Ebola. Again, politicians injecting themselves into all of this. Your thoughts on that?
Politicians are not public health officials. They didn't study public health. They basically studied politics, how to get votes, how to get bills passed, and to politicize this is really a huge mistake. We'll look back on this and be quite embarrassed.
Robert Murphy joining us from Chicago. Thanks so much.